I'm Brett Cooper, and this is the Frontline Mobility Edge, where we discuss the latest in mobile device technologies and how they're shaping the frontline landscape business. Thank you for joining us. Let's get started. Hello, welcome to this episode of the BlueFletch Frontline Mobility Edge. I'm joined by Lee DeHihns, and today we're going to talk about a report that BlueFletch recently commissioned for frontline nurses and hospitals in North America, or US to be specific. So we did a survey specifically to learn more about the experiences and feedback on mobile technology for nurses that work in these frontline roles. So it's hospitals, clinics, some home health care. It's a pretty diverse group of nurses, several hundred nurses, so it's a decent sample size. But wanted to talk through this, and Lee and I called a couple topics that we thought were interesting, so we'll cover those and dive into a couple of those here in a second. So Lee, thank you for joining me. To get us started, I'll just do a quick framing. The survey was, I think we had about 30 questions focused on a lot of the what systems do you use, what's your experience, what's your feelings, what's your feedback on the good, the bad, the ugly, what would you like to see more of? So a couple of these we called out. I guess, Lee, the first one that you called out, which I didn't even see until you said it, was the number of years of experience. I think this was over 60% had more than 6 years of experience. And as I thought about it, compared to like other fields we work in, it definitely was a pretty high number.
Yeah, I think so. To me, what that shows is the people in nursing are in this as a career, and they're invested in it, not only from just a livelihood perspective, but caring about what they're doing and making sure that they're increasing better outcomes for patients, for the people they're taking care of. So if they're spending, in many cases, the balance of their lives in these careers, then it's important to them that the tools that they're using are going to make their job easier.
Yeah, I think the other piece of this was just with those tools. I think one of the questions was the experience, how people felt their experience was with technology itself. And I think over 90% of the respondents ranked themselves as intermediate or better, or intermediate to experts in regards to technology and using technology in their job, which to me, I know everybody ranks themselves above average, but 90% is definitely, a lot of people have spent a lot of time learning these systems and investing a lot of their career into them.
Yeah, I don't know if people think of nurses as technicians or technologists, but they definitely are. Next time you go to a doctor's office, or if you happen to be in a hospital for one reason or another, look around at the tools, and they require an incredible amount of training just to be a proficient at them, much less, be good at them and use them to improve what you're doing.
I was, one of my kids had a broken arm recently, and I was incredibly impressed with how fast the nurse typed with gloves on. He probably typed about 4 times faster than me and was wearing gloves. I was like, man, this is awesome. So definitely not an exact indicator of technical proficiency, but definitely somebody who knows the systems and is able to navigate it quickly.
Yeah.
The next topic we had, it was that you and I called out, was just issues with mobile devices. So a lot of the questions we had in the survey were around different mobile devices people used and the things that were frustrating to them with those devices or issues they had was one of the questions. And there were a number of issues that people listed. The top 5, I'll go through them one by one. I'd like your feedback as we go through these. But number 5 was coming in. 18% of nurses articulating this as a point of frustration was concerns with patient data security. What's your read on this one?
So I think it shows the fact that this was prevalent shows the degree to which patient privacy and security and HIPAA compliance is very important in healthcare, and the training with that and the practice that the nurses put into that is very important to them. And so the perception that if you have a device, particularly that's shared, may increase the exposure for a data breach, I think is where the thought process is going there. So if you're used to doing something on a dedicated device and then you have to share a device with other people, the nurses want to make sure that they're not going to be exposing important information where it shouldn't be.
That's interesting. I actually read this the opposite direction. In one of the earlier questions in the survey, we asked nurses about, whether they use a shared device that's provided by the hospital or whether they're using their own personal device. And I think even though some hospitals did provide shared devices, it was over, I think 45% are using a personal device on the job at work. And I actually, when I saw this response, it made me think of how many nursing conversations are happening on WhatsApp or some of these other applications that may not be managed by the IT teams.
Yeah, definitely. There is that shadow IT side of it, and I think it goes back to the first point we talked about with the people that are in nursing roles are in this for a career, and if the tools that are provided for them are not getting the job done, they'll use another tool or they just won't use a tool at all because they need to care for the patient and the patient outcome, which is why you end up with WhatsApp groups for, the OR or labor and delivery or something like that.
Yeah, yeah. Shadow IT sounds a lot cooler than what it actually is, though. That's a good term for it, but it definitely it is a little sketchy at times.
Hmm.
The next complaint or concern that nurses had with mobile devices was, and this came in also at 18%, was that mobile batteries do not last a full shift. What's your readout on this one?
Yeah, it's interesting. To me, and I'd be interested to hear your take. To me, this sounds like there's a fair amount of penetration still with devices that don't have swappable batteries. So specifically thinking of like iOS devices, for example, or devices that are not meant for really heavy use. And if you think about, particularly if you have an iOS device that is dedicated, either a personal device or one from the organization, those devices are being used constantly. And when the battery runs down, you're either A, going to put that device down and not use it, or just try to use it as sparingly as possible throughout your shift to try to make it last. And neither one of those is ideal.
Yeah, when I saw this, it made me think there was one of the qualitative comments that one of the nurses had is that it was, I think in the freeform section, it's like message of leadership. It's like we have iPhone 8s, we need to replace them. It just made me think of like if you're using a iPhone that is 9 years old, there's probably a good chance the battery is not going to last more than 3 hours.
Yeah, that was a surprising one to me. I remember when you and I looked at that yesterday, I was like, that's an old phone.
All right, so moving on to number three. So, of the top five issues that nurses articulated with mobile devices, coming in at 24% of the nurses saying this is a problem, but software frequently malfunctions or crashes. What's your thoughts on this one?
Yeah, I mean, that's a tough one, right? Because the reasons that software may malfunction or crash can be myriad, right? And so I think it indicates that there could be more done from an infrastructure perspective on bandwidth within a hospital. If you've got mobile devices deployed on every floor of a hospital, and hundreds of people working there, all using them constantly, but haven't accounted for that from a network perspective, that can cause issues on that device to hang up or, in the eyes of the end user, crash or not work or malfunction. The other side of it speaks to the point that perhaps the software that's being rolled out is not being tested thoroughly enough before it's deployed to the user groups, to actually use to care for patients.
Yeah, and there's a lot of software. I know we got the list from nurses of the types of software they use, and it's pretty widespread. Everybody uses an EHR, which we'll talk about there in a second. But I think there are a lot of different pieces out there. There's also some another just topic we'll get to in a second when we get to what nurses actually want. So next issue I had was the coming in number two at 26% of nurses articulating this as a concern was lack of technical support.
Mhm.
To me, I read this and I'm like, it must be incredibly frustrating to be out on the floor, have a problem, and need to see patients and call the help desk and like, oh, you're calling me, we'll get to you in 10 minutes. Like you don't have 10 minutes. You have to be able to get out there and do things. So what is your thoughts around this? Is there anything you've seen with the customers we're working with in regards to the technical support side?
Yeah, we talk about I feel like we've talked about this on other podcasts, is particularly in IT departments that are tasked with a number of practice areas that they need to be on top of simultaneously. there can be a tendency to deploy a technology, so shared devices with, let's say, 6 applications for nurses. Once that's deployed, they move on to the next project. Maybe it's, adding more access points or repairing workstations on wheels or helping, a set of doctors come up with a software solution for a project they've decided on. So the IT department is pulled in all kinds of directions. And I think when you're rolling out software and putting devices in hands of people that are going to be using them on a daily basis throughout their shift, you really have to think about the support that needs to go into that so these devices can be utilized in the manner that they're intended.
Sorry. Yeah. Day two is definitely more expensive than the rollout day.
Oh yeah.
Yeah. Number one, the issues of mobile devices, and this kind of hurt me a little bit when I saw it, but it also gave me some hope. So login and security make mobile technology hard to use. That came in at 27% nurses complaining about that.
Yeah.
I just feel like Lee is probably not doing a good enough job spreading the word about BlueFletch and our login solution. But what was your take on this one?
Yeah, there's a few things in there. I mean, obviously no one likes to type the password that got assigned to them. That's 16 characters of numbers and letters and weird carets and things like that. And that's just not fun to do over and over and over again. And there's Imprivata in the marketplace with 95% market penetration. It makes me wonder how penetration is defined, because from a single sign-on perspective, that hurt my heart a little bit too, is people should be able to pick up this device very simply, for example, tap a badge or enter their password only once at the beginning of the day and have everything ready to go.
Yeah, it's interesting. So I'll move on to the next topic. This was really the impact of mobile devices in the work. This is sort of the flip side of the positives of this, and the thing that stood out to me was looking at the survey. And this is like, how do you feel about software and mobile technology? And over 98% responded that mobile devices increase quality of care, increase their efficiency, and reduce patient errors. And so, and those were 3 separate questions, and they were all over 98% responded. Some of those were 99%, but it's clear to me that putting these devices in people's hands gives them a advantage when they're out on the floor and they're helping serve patients and work with patients. What are your thoughts as you looked at those numbers, looked at some of the positivity from the nurses around the advantages of mobile technology?
Yeah, I found those numbers very encouraging, but it does point to the importance on having technology at the point of care, right? So you're not at a bedside, but then having to walk back to a shared workstation if there wasn't a workstation on wheels available for you, for example. And also, if you go back to the first topic, we talked about the concerns about battery life, software malfunctioning, lack of technical support. Even with those hurdles, the nurses are still finding that these devices are 100% critical in terms of getting better quality of care and better outcomes for their patients. So to me, it makes the hurdles that they have to overcome and that they're willing to overcome that much more critical to eliminate them if we can.
Yeah, I think also on that note, like the preference of technology, I think it was 71% preferred mobile technology and 3% preferred workstations on wheels and fixed computers. So that was definitely it's clear that nurses would prefer to have mobile devices or tablets in their hands as opposed to having to roll around a workstation on wheels or deal with Windows machines.
Mm-hmm. Yeah, even with all those complaints, they're better than a workstation on wheels, which is just interesting. So if you could get rid of the security concerns, some of the battery life concerns, not that you're necessarily looking at making our numbers better in our survey, but just think about how much better your outcomes could become if that device was always available and easier to use.
Yeah. The next topic, and this was, it was interesting to meet you and I as we looked at it, just because we've talked to a lot of hospitals and healthcare systems, and this question was specifically around what EHR nurses are using on their mobile devices, and number one, no surprise, Epic came in at 40%. Number two and number three were surprised me. So Meditech at 33%, and then athenahealth at 24, and then number four, Oracle Cerner was 14. I feel like if you did this 10 years ago, Cerner would probably be a much higher percentage.
Mhm.
What's your thoughts on sort of the shift? The Epic is no surprise to me, but Meditech and athenahealth, your thoughts on those two?
Yeah, that was surprising to me. I'd love to, sit down and talk to some of the people who answered this and have them explain to us a little bit more about, why Meditech seems to be as prevalent as it is in the survey, but not as prevalent when we're talking to hospitals from a customer perspective. So I'm wondering if there are, relatively newly arisen cost constraints that people are thinking about, or we'll get to it a little bit later, integration points that maybe are a little bit easier in some of these systems that haven't been around quite as long, that they're built to be a little bit more modular. There's a few different things I can think of, but I would love to learn a little bit more about it.
Yeah, and I think that now that you say it, I think less than 60% of the respondents on this survey were in hospital nurses. So a lot of them they work in clinics, they work in emergency care, outpatient, or they work in home healthcare. So I think that might have some swaying of the numbers of what systems are using.
Yeah, exactly. I don't think we have it in our survey, but it'd be interesting to see if it's skewed. To your point, we don't have a penetration of a particular healthcare segment of EHR. We just have it across the board.
Yeah, it'd be interesting. I'll go back, take a look at the numbers on that one. That's a good question. All right, the next topic was login approach. This one was another one that surprised you and I when we looked at it. But in the survey, 52% of the nurses that responded said that they're still using username and password for logging in versus 25% using badge tap.
Mhm.
I know there's products like Imprivata and BlueFletch and other things that are out there. Was it surprising to you that only 25% are using badge tap to log in?
Yeah, it was surprising just because, when you think of healthcare as a non-healthcare person, like a lay person, every time you're in a facility, there's badges everywhere. There's, sensors next to doors. They're in every one of the rooms when someone walks in, checking in, all that kind of stuff. You would assume that the ubiquity of that usage would extend down to the mobile devices, but it just shows that they don't. And so I think maybe that could be some of it is just there isn't a tool that's easy enough to use on the device to facilitate badge tap that's been adopted enough yet, or maybe there's some differences in badge types between, like I know a door RFID proximity tag is going to be different than what is used on the majority of mobile devices. So maybe there's a little bit of like a technical debt turnover that needs to happen, but I was surprised by that.
Yeah, and I think this one coupled with the next thing that stood out to me was just the number of logins per day where people are having to do that login approach. So it was a follow-on question, and I think was it almost 80% of users are logging in more than 3 times per day, and
Hmm.
then it was over 30% are logging in more than 10 times per day. So it's definitely there are a lot of logins happening. I know based on research we've done in the past, typical username password will take you 30 to 40 seconds. So if you take that and multiply it times 10 or 20 logins per day, it gets very expensive for a lot of these people from a time perspective.
Yeah, it's very expensive from a time perspective. So if you're looking at labor and rev cycles are extremely important to hospitals. I was talking to someone earlier today who has a nursing informatics background, and that's one of the things she talked about in terms of one of the most important metrics they look at quarter over quarter in hospitals and year over year is the rev cycles within there. And it's not hospitals are making tons of money. That's not where the rev is coming from. It's hospitals are bleeding money. 45% of hospitals in the US don't make any money at all. So the fact that you have to spend that much time logging in is concerning from money that could be better used toward either technological improvements, clinical improvements, patient outcomes, things like that. It's a concerning number, I feel like.
Yeah, yeah. And I was reading there was some feedback from a CIO on around this question of why don't companies invest in this login problem, and they can he goes on the flip side, you have it's $400,000, $500,000 a year for a login solution that reduces all that time you spent, or you're buying a new MRI machine for $2 million. So he's having to compete with that spend cycle as they go to the board and try to get approval for those types of things. And there feels like they're always going to go towards the new equipment or machine, even though if it in the grand scheme, some of that software may actually be more beneficial to the nurses and the patients in their care scenario.
Yeah, I think there's probably a whole topic with that CIO I would love to talk to you about in terms of, with a new piece of machinery like an MRI, the number of appointments you can book into it and the amount of quantifiable codes that you can submit from an insurance reimbursement perspective versus saving a floor of nurses' time on logins would be interesting.
Yeah, it's probably a lot easier to justify to the insurance companies when you're putting it that way.
Yeah.
So the next topic, and this is another interesting one that stood out to you and me, which is what new technologies do nurses want, or what do nurses want with technology? And the thing that was highest on the list definitely surprised me. I thought it'd be AI or dictation or other things, and the thing that was highest was better integration between different systems.
Mm-hmm.
And as soon as I read it, I got it, because they have you have your labs, you have all these monitoring systems, you have communication, you have your EHR, and a lot of these systems are not set up to talk to each other.
Mm-hmm.
So you're taking data from one system and putting another. And I as soon as I read the answer, this came in at, I think 41% of nurses ranked this as their top technology. I think they want to improve the technology, and it's just, to me, it's like, oh, I get it, but I would never have thought about this before we got the survey results back.
I'm the same. I had the same reaction when I saw this. It makes a ton of sense, but also I think you and I weren't thinking of it from that perspective. But yeah, if you have to go to one system to look at an X-ray, another system to look at the last time you talked with that patient, and then another system to see when their next appointment is, that's really convoluted.
Yeah, and number two and number three were, I guess they weren't as surprising. Number two was not surprising to me, which is improved. Number three was not, which is improved mobile tablet applications. So can we get better applications? This kind of goes along with the apps crash, or stuff isn't tested before we get it. But the number two, which was advanced AI diagnostic tools, and that came in at 39% of nurses would like to have this. And this, to me, seems like, you talked about this at the top of the discussion, nurses have a desire and the experience to use advanced tools, and putting these AI tools is definitely something that's something that a lot of hospitals may be slow on. The nurses definitely want to adopt those.
Mm-hmm. And I think where I've seen a lot of conversations around this, a couple areas that are interesting to me is from like a dictation perspective and an ambient listening perspective, but then also one that's like directly clinical, for lack of a better way of putting it, is in wound care, for example. You can use AI on mobile devices to measure the size and depth of a wound and have that integrated directly into the EHR. And that is a big part of how wound care is tracked, is in terms of size of wounds and outcomes. So the fact that something like AI can be used for that didn't occur to me until it was mentioned to me yesterday on a call with a hospital.
So I'll move us to our last question, which we want to call out, which was just the topic of AI. So we had a number of questions asking nurses around their feelings of AI, whether they're pro or anti, problems or concerns they had with it. And the question I wanted to articulate here is really just I think the question was regarding AI, how do you feel about it? And we had a number of things. And the thing that stood out to me is what was it, like 95% of nurses were very positive about AI and would like to have more of it
Mm-hmm.
in their hospital. And I think the things they want to use it for, things like dictation, helping with predictive, patient monitoring, and then also like the care plan follow-up. So when you send a patient home, being able to have AI help with those. And all of those were ranked very heavily in the positive side of nurses want to leverage more of that technology to help them with their jobs.
Yeah, I thought it was really interesting as well. I also was surprised that more than a quarter of nurses indicated they're already using AI in their day-to-day practice. So I, that number was higher than I think. I'd be interested to see that on industry over industry to see where healthcare ranks um, outside of, amongst other industries, particularly as ones as large as they are in terms of when you look at the percentage of the economy. That was an interesting one to me too.
And I'd also be interested in what percentage of that 26% is shadow IT apps or apps that are not provided by the IT team, but are things that the nurses on the floors are using to actually improve their patient care.
Yeah, I've got 7 more minutes till I can get the free chat GPT to tell me what to do.
Oh no! All right, so like I said at the top of the call, so this is a survey we recently did. We'll be putting together a white paper and compiling it. Follow along at BlueFletch.com if you're interested, or reach out to Lee or myself if you're interested in getting a copy of that white paper when it comes out. I think the big topics, so nurses do want mobile devices. They like them. There are some issues around login and support that they would love to have, and battery life they'd love to have improved. AI capabilities, nurses definitely want more AI. Integration with different systems is a big desire to have better integration. And then, I think on the login side, I'll throw a pitch out there for BlueFletch. If you're looking for better login for your nurses, definitely reach out to Lee or myself, or hit us up at BlueFletch.com. We'd love to talk to you. But Lee, thank you for joining me on this. And anything else you had to throw out there?
No, thanks for joining us. The survey ones are always fun. And if anyone listening is going to be at Vive or HIMSS coming up at the end of February and beginning of March, BlueFletch will be at both of those shows. We'd love to have you stop by and say hello.
Excellent. Thank you.
Thanks.
Thank you for tuning into the Frontline Mobility Edge. If you enjoyed this episode, make sure to subscribe for more content every month. If you'd like to learn more about BlueFletch, check out the link in the description or visit us at BlueFletch.com. See you next time.